In the 2000s, there were multiple high-profile food recalls which brought food safety to the public consciousness in a major way. These major nationwide and in some cases international food recalls brought to the public attention that there were gaps in the food safety system and that it was putting consumers at risk. While all of these recalls were going on, other producers were able to see the high cost of food safety mistakes and began to look for ways to reduce their risk profile and lower their exposure to liability. No food producers want to sicken any customers, but even a recall without illnesses can have serious financial impact on a company. In the United States, legislators also became involved in the goal of improving the food safety system, and in 2011, President Obama signed into law the Food Safety Modernization Act, requiring food producers to take a proactive approach to food safety. The Centers for Disease Control and Prevention collect data on foodborne disease outbreaks submitted by all states, the District of Columbia, and Puerto Rico through the CDC Foodborne Disease Outbreak Surveillance System. Data reported for each outbreak includes the number of illnesses, hospitalizations, and deaths, the pathogen, the type of food involved, and other factors involved in food preparation and consumption. During 2009 and 2010, a total of 1,527 foodborne disease outbreaks were reported, resulting in 29,444 cases of illnesses, 1,184 hospitalizations, and 23 deaths. The types of foods associated with these outbreaks indicates that while the familiar meat, poultry, and dairy were common culprits, less suspected produce was still a significant contributor to foodborne illness outbreaks. Additionally, when produce items are implicated in an outbreak, there are more cases within the outbreak. Because of these factors, it is important for all food producers to be aware of food safety hazards and take measures to control them, even if only producing or handling produce items and not the traditionally high-risk items such as meat, poultry, and dairy products. In the past few years, there have been some significant outbreaks that further point to us that minimally processed foods are still at risk of contamination. In 2012, the Sunland peanut butter outbreak resulted in 42 reported illnesses in 20 states. FDA suspended Sunland Inc.'s registration, prohibiting them from selling food in November 2012, in the first use of FDA's expanded powers under the Food Safety Modernization Act. In 2011 and 2012, cantaloupes were involved in two separate major outbreaks. First, in 2011, cantaloupes contaminated with Listeria monocytogenes were responsible for 147 reported illnesses in 28 states and 33 deaths. The following year, in 2012, cantaloupes from a different operation were contaminated with Salmonella. These cantaloupes were responsible for 261 reported illnesses in 24 states and 3 deaths. As product is sold nationwide and even internationally, many different types of products are subjected to random screenings for pathogen contamination. Sometimes this random testing identifies product which is suspected or found to be contaminated, and even though there are no reported illnesses, the producers must recall these products to protect the consumer. This also triggers an investigation by the FDA, local health departments, and often the retailers. So while the producers are fortunate that their products haven't made anyone sick, a recall without any reported illnesses is still difficult and expensive for the companies. Outbreaks are very concerning, but they account for only about 5% of the total number of foodborne illness cases each year. An outbreak can't be declared until 2 or more people report illness symptoms and are found to have consumed the same food or drink. Illnesses which are not part of an outbreak are called sporadic illnesses. The CDC estimates that outbreaks and sporadic illnesses combine to approximately 48 million people who report foodborne illness symptoms each year. That's approximately 1 in 6 Americans. Of those cases, 128,000 are hospitalized and about 3,000 people die each year from foodborne illnesses in the United States. No industry wants to be responsible for causing illness, suffering, or death of its customers. But beyond the direct health costs of contaminated products, many food sectors also suffer extensive monetary losses when a product is named as having caused an outbreak. This is especially true for produce products, which are hard for the consumer to identify a specific brand while they are shopping in their grocery store. In 2006, the spinach outbreak is estimated to have cost the industry over $350 million. The 2007 peanut butter outbreak is estimated to have cost $78 million. In 2008, tomatoes were wrongly accused as having caused an outbreak, and this caused the tomato industry to suffer a loss of $250 million. Preventing a single fatal case of E. coli 0157H7 infection could save an estimated $7 million nationwide. Loss of consumer confidence in the named brand or brands, and often the entire food sector, occurs following a highly publicized recall. In 2006, spinach shipments were hit with this loss of consumer confidence following a mid-September advisory notice from the FDA for consumers to avoid products with raw spinach. When surveyed, nearly half of Americans reported that they had eaten fresh spinach before the recall, and most did so relatively frequently. While the recall was underway, consumer awareness was very high. The majority of Americans reported they were aware of the spinach recall. By September 20, 2006, the FDA had confirmed the contaminated spinach had been in a single growing area in California. On September 22, the FDA began advising consumers that it was safe to eat fresh spinach grown outside of this growing area. Yet when asked where the contaminated spinach was grown, only 52% of the respondents correctly reported that the contaminated spinach had been grown in California. More than 6 weeks after the FDA had issued its statement on September 22, 2006, advising consumers that they could be confident in eating spinach grown outside of the 3 counties in California, more than 1/10 reported incorrectly that the spinach recall was still in effect. As you can see from this graphic, not only were consumers slow to regain confidence in spinach, but the price of spinach also dropped, which made it all the worse for spinach growers and shippers. In response to the outbreaks we have discussed and many others, the American public pressured Congress to improve food safety legislation. This new law is called the Food Safety Modernization Act. It was signed into law by President Obama in January of 2011. It creates new mandatory federal regulations for food safety, requiring preventative food safety based on hazard analysis and preventative controls, and it expands existing food safety programs. The United States has also established performance standards for various food safety hazards and tests products to ensure that these standards are met. For example, along with mandatory HACCP in meat and poultry plants, FSIS has in place pathogen reduction performance standards for salmonella that slaughter plants must meet. Such standards provide a basis for plants to calibrate their process control measures. As another example, FDA has established a 5-log pathogen reduction performance standard in its juice HACCP regulation. Which is your business regulated under? FSIS, or Food Safety and Inspection Services, is under the USDA and has jurisdiction over meat, poultry, and processed eggs. FDA, or the Food and Drug Administration, has jurisdiction over other foods including seafood and produce. In addition to expanding regulatory standards, the food industry has also been developing its own system of verification and certification. GFSI was launched as a nonprofit foundation in 2000 to achieve a safer supply chain through the harmonization of food safety standards that would drive a reduced audit duplication throughout the supply chain. At the same time, there was no existing scheme that could be qualified as global that could be adopted by all. GFSI therefore chose to go down the route of benchmarking, developing a model that determines equivalency between existing food safety schemes while leaving flexibility and choice in the marketplace. While this remains one of its key activities, its collaborative approach to food safety brings together international food safety experts from the entire food supply chain at technical working group and stakeholder meetings, conferences, and regional events to share knowledge and promote a harmonized approach to managing food safety across the industry. Some of the audits that fall under the GFSI umbrella include the Global Aquaculture Alliance Seafood Processing Standard, the IFS Food Standard, Canada GAP, FSSC 22000, SQF, BRC, and Global GAP. The key priorities of the GFSI benchmark are to benchmark food safety standards worldwide, to improve cost efficiency throughout the food supply chain, to provide an international platform for sharing best food safety practices and information. The key elements of an audit that has been benchmarked to the GFSI standard include a management commitment to food safety, core food safety practices in the form of GMPs, GDPs, or GAPs, and HACCP as a foundation for food safety planning.